Let's talk a little bit about the treatment of end-stage kidney disease. Firstly, what is end-stage kidney disease? Your kidneys have a certain amount of natural functions which they are born with. If we are talking about how much function should a natural kidney have, just think in terms of your fingers. Every person should have around 10 or 12 fingers worth of function. With time and with disease, this function keeps coming down. When it is below 1.5 fingers or a GFR of 15 ml per minute, majority of the patients are said to be under end-stage kidney disease, and such people are unable to continue to live unless their kidney functions are replaced by some other means. If you go and visit your nephrologist, this is the time he will talk to you about renal replacement therapy. The term itself explains what does it mean. Renal means kidney. Replacement means you replace a non-functional organ with another organ. Think in terms of a fused bulb in your house. If your bulb fuses, what do? Either you use a table lamp for some time or you replace the bulb. So that's a replacement. Therapy is treatment. So what are your options? The first option of renal replacement therapy is dialysis. There are two kinds of dialysis. One is blood dialysis, second is peritoneal dialysis. In blood dialysis, you go to a hospital or have the arrangements at home where a dialysis machine, which is an artificial kidney, does the work of your kidney, filters and cleans your blood and returns the clean blood to you. You go back home after 4 odd hours of dialysis. This is what is called hemodialysis. There are many subtypes of hemodialysis, such as standard hemodialysis, high flux dialysis, hemodiafiltration. That is a topic for another day. The second form of dialysis is what is called peritoneal dialysis. So instead of using a man-made artificial kidney, there is an inner lining inside your stomach wall called the peritoneum. And the peritoneum is used as an artificial kidney to filter your blood. In such cases, we put a small catheter inside the abdomen. The person fills his abdomen with dialysate fluid at home, removes it after 4 to 6 hours and continues repeating the process 3 or 4 times a day. The second major kind of renal replacement therapy is kidney transplant. In this, we take a kidney from a healthy voluntary donor. Each person is born with 2 kidneys. One person can easily donate 1 kidney to another person and continue living an absolutely normal lifestyle. In such cases, we take the kidney from a living healthy donor or a person who is brain dead and give the kidney to a patient who has got end-stage kidney disease. This is called kidney transplant. In this condition, the patient can go back to an absolutely normal life. Of course, there are certain medications which go on for life, which are the immunosuppressive drugs. But restrictions of movement, restrictions of food and restriction of activity is very minimal, and they are independent of dialysis. So these are the 2 broad terms where we talk about renal replacement therapy. Please do understand that a dialysis is not a death sentence, it's a life sentence. This is the only organ that man has been able to replicate artificially. So, of all kinds of organ failure, it is only the kidney failure patient who can live happily for a long time using an artificial kidney or undergoing kidney transplant. So, do not fear the therapy, embrace it, accept it, and live a healthy and fruitful life. Thank you very much.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.